what I want to inspire in you, or my message is, prostate cancer is not a death wish. Okay, we're talking about a cancer, but it's not a cancer you're going to die from. It's not a cancer. It's, in a weird way, it's a cancer you don't mind getting because it's very treatable. Okay, and I think that's very important, that as young guys who are healthy, strong, feeling good, all of a sudden the doctor's telling me I got cancer. I'm like, I don't even feel it. And that's pretty typical of prostate cancer. You don't feel it because we catch it so early. You don't want to feel it. I tell patients all the time, you never want to feel prostate cancer, because if you do, it's usually more advanced. Okay, so even though it's a cancer, it's a very treatable form of cancer. And I pulled these numbers from this is not doom and gloom, and I don't mean to be rude or crude, but I want to really put it in perspective. And these are the causes of death and the lifetime odds of dying. The most likely cause of all of our deaths is going to be heart disease. 1 out of 5 people will die of heart disease. Next is a stroke. That's 1 out of 23. Next is accidental injury, hit by a car accident, something like that. So that's 1 out of 36. And then when they look at prostate cancer, it's 1 out of 38. So what it's important to know is that you're most likely not going to die from prostate cancer. You're mostly likely going to die of heart disease, a stroke, or even an injury. Okay? So your lifetime risk of dying of prostate cancer is 2.7%. It's very small. Obviously, we want to see 0, but we got to be realists with ourselves, and odds are you will not die from this disease. Motor vehicle accidents, 1 in 100. Falling down, 1 in 246. And then if you in a plane crash, it's about 1 in 20,000. Just to keep that, believe me, people, you calculate everything. These are all from life insurance tables predicting how people die. But what the point is, prostate cancer is not a death wish. Okay, it's a very treatable disease. It's a bump in a road, a problem that we can fix, and in the end, you'll be fine. Okay, and I think that's what you always got to remember as you go through this process. Okay, one things that we talk about, and this kind of will explain why prostate cancer is not a death wish. This was a JAMA article, which is one of the premier medical journals, is that there's a lot of heterogeneity. There's a lot of different types of prostate cancer within prostate cancer. So not all prostate cancers are the same. Most prostate cancer moves very slowly. Okay, and this is the snail prostate cancer. These are the guys that will have prostate cancer and it will never progress. Whoops. I'm sorry. It will just stay like this. And that's what I call the snail. It moves like a snail. The next form of prostate cancer is the turtle. Again, very slow growing. When we catch it right here, patients do fine. And that's where most of the time we catch it. Sometimes we have a little bit more aggressive prostate cancer, and this can move, I think this is a hair, but it can move a little bit faster, and if we catch it, patients will do all right. There's a small percentage of prostate cancer that really just takes off on us, just takes off, which we rarely see, but does happen, where it can just, no matter what we do, it just takes off. Usually we find these patients advanced at the time of diagnosis. So that's kind of a rarity. Most people are in these categories. Very slow growing, non-aggressive. We catch it and treat it at the appropriate time. Most patients will do fine.